2015 small group Delta Dental plans. And so I'm going to go ahead and turn it over to Mike Elam. He's our account manager for KHI, and he's going to walk us through the presentation. And as always, we'll have questions at the end. And Mike, I'll go ahead and turn it over to you.
Okay, great. Thanks, Lynn. Appreciate everybody joining this afternoon. Maybe some of you were with us this morning. We did talk about individual dental this morning, so we're going to take a little time this afternoon now to talk about the 2015 small group products that Delta Dental has to offer. And included in this presentation, we'll talk not only about the dental products, but also a little bit about the vision products as well. So again, appreciate your time today. So we'll just jump right into eligibility for small group products, and I know there's a lot of, between regulatory definitions and different carrier definitions, there's probably a lot of different ones floating around these days. But as far as Delta Dental goes, for 2015, we define small group as 1 to 50 benefit eligible employees, and this just kind of goes through some of the details of what a benefit eligible employee might be. Now, we use as kind of our default 30 hours per week, but honestly, we let the employer determine that. So if the employer's got somebody that works 20 hours a week, that they want to consider those people benefit eligible, that's fine by us. We're just going to want to have those folks included in the eligible count to start with, and then when we count our participation and so forth. Since Delta Dental of Iowa is just in Iowa, the employer needs to be headquartered in Iowa. Now, that's not to say they can't have employees anywhere in the country, but the headquarters, or the decision-making, if you will, about the plan needs to be located in the state of Iowa. So there's some employers, obviously multi-state, that becomes a question once in a while. We've got agreements with other deltas that wherever the headquarters is, that's where the business goes. To qualify for a group, they must employ 1 or more people with combined worked hours of 1560 in the previous year. That's sort of a technical definition. Employees don't include owners, their spouses or family members, or seasonal workers, which is 120 days or less. So we get into this once in a while. We can have groups of 1, but the group of 1 needs to be an eligible group, having at least 1 employee that is not an owner, their spouse, or their family member. So they've got to have somebody that's earning a salary or earning a wage that's not a member of the owner's family, doesn't have ownership interest in the business. That's what it takes to qualify for group coverage. Now, we have a lot of times where they'll have that employee decides not to enroll, and the only people that enroll are the owner, their spouse, or family member, and that's just fine because they've met the eligibility test for group coverage. Okay, so this slide just talks a little bit about the dental essential health benefits, which in the small group space, they don't have to necessarily offer them. Some employers choose to. So we've got 2 different versions of our products, and we'll talk about those a little bit more in detail as we go through. But we've got what we call our plus versions of products that include the ACA-defined pediatric dental essential health benefits. And this slide's in there just to point out what those EHB benefits are. So it is coverage for preventive care for children, coverage up to 19, but we extend that up to age 21. So we go a little bit above and beyond what the ACA defines, in that we consider a child for both benefits and for rating purposes to be anywhere age 0 to 20, and then 21 they become an adult. There is no annual or lifetime benefit max for children's dental benefits. There is coverage for medically necessary orthodontia. This is not your typical, corrective orthodontia that you think of with braces and so forth. This is for medically necessary, which is a fairly extreme medical condition. The primary example of this that most people give is if somebody's got, cleft palate and has to have that fixed, things like that. But it's a fairly significant medical condition that requires orthodontia. There is coverage for that, but not for your normal cosmetic type ortho. And then the big one that most people look at when they decide for a plus plan is that the maximum out of pocket for children is $350 per year per child, or $700 for all the children in the family. Okay, that's the big one, and that did change for 2015. Those two numbers were doubled last year in 2014. It was $700 per child, $1,400 per family, but they cut that in half for this year, and I don't think they're going to change it again. I hope not. We just want them to kind of stay where they are for a couple of years, but it's $350, $700 at this point. And I alluded to this, but the question, do they need to buy a plan that includes these dental EHBs? And technically, I mean, individuals are supposed to have these pediatric dental essential health benefits covered, but they don't have to buy them from the employer. The employer does not have to offer them necessarily in this space. It does need to be available for purchase in the state, which Delta Dental takes care of because we do offer these ACA compliant plans in the state of Iowa. So in essence, we make it okay for anybody else to not offer them because they are available in the state from Delta Dental. Medical carriers don't have to offer due to this what we call reasonable assurance approach because, again, medical carriers can be reasonably assured that these products are available in the state, and if somebody wants them, they can get them. And then again, I think, this is just kind of my opinion here, but agents should tell everybody that they are available. I think it's a good checklist item for you as an agent to say, yes, we told them that ACA compliant plans are available. Even if they choose not to buy them, you've got that documented. And so then when you're talking to an employer and they're considering, do I buy an EHB plan or do I not? Again, these are what we call our plus plans. The answer should be yes if they want a maximum out-of-pocket of $350 per child or $700 for all children, or if they want coverage for medically necessary ortho, or they want no annual or lifetime max on child benefits. So again, that's the other thing. Once the child hits this $350 per child or $700 for all children max or maximum out of pocket, there is no, as we think of in the traditional world, there's not an annual benefit maximum or even a lifetime maximum. Once they hit that annual out of pocket, everything above that is covered. Now, so that's when they would want to buy one of those ACA plans. If they answer these other things no, as far as do they only need to cover adults, are they supplementing medical care or a medical plan that might have pediatric dental embedded, or if they just want all their family members to have the exact same deductibles, co-insurance, and benefit maximums, then they probably don't want one of the ACA plans, and they're going to buy one of our prime plans, is what we call them.
So, Mike, you're using EHB synonymously with ACA.
Yeah, I am, and that's probably confusing, but yeah, it's the essential health benefits that are defined by the ACA. Yep, thank you. Okay, so this is just kind of an overview chart. We've got several different types of small group plans. And so this is kind of, again, maybe something to start the discussion with, or the thought process with, as far as what type of plan might be appropriate for the individuals that you're talking with. And so in the green there, in the columns, the green one is what we call our employer choice plans. And that's the traditional where the employer decides which single plan they want to offer the employees, and then the employees either enroll or they don't. The next one over in the kind of orangish color, the voluntary employee choice plans. This is where truly voluntary, where the employer can decide, yeah, I'm going to put this in, but I'm not going to contribute anything to it. the employees actually here get to choose from, as we'll see, 6 different plan designs. And so really from an employee standpoint, it's a great plan. It can be a little confusing sometimes, but it gives the employees a large range of options to choose from. And then we include it in here now just because it's become, I think, more relevant even to some employers who decide, maybe not to offer a group plan. There's still options, and we talked about these this morning, for employees, and that's the individual choice plans. So we've kind of brought these now into the discussion even when we're talking about small group. It's important to remember that those individual plans are still out there. So then now going back, and you kind of look down each of the columns, you can see the different things that are available in the employer choice plan. Now optional, as we've talked about, is the pediatric dental services that meet the ACA, or these EHB benefits that I was talking about. We've got versions that have those under all 3 of these different types of plans, but it is optional. You see the key things here. The employer choice plans, they all include preventive services, routine and major restorative services. There are no waiting periods on any of our small group plans, even the voluntary plans. One important feature that a lot of people like under this employer choice plan, the green, the first column, is the to-go benefit. And that's where the employees get to carry over any unused portion of their annual benefit maximum. So they can roll that over. It's kind of like, your rollover minutes on a cell plan or something like that. And all of the employer choice plans include that automatically. That's in there at no additional charge. And we'll talk a little bit more about how that feature works. They also include the Enhanced Benefits Program, which certain medical conditions have been shown to really require more frequent dental services, such as, not to call it a medical condition necessarily, but pregnancy, chemotherapy, kidney dialysis, some treatments like that, that if you've got people that are undergoing those kinds of medical situations, they do require more dental services. And this Enhanced Benefits Program, which again is automatically part of our employer choice programs, provides for those additional services. They just need to notify us. The employee just needs to call and say, hey, I'm pregnant, or I've got this condition that qualifies. They will receive those additional dental benefits, again, at no additional charge. That's automatically included in the program. Optional corrective ortho coverage. The only plans that you're going to have coverage for corrective ortho are the employer choice plans. And then we've also got optional there as far as employer contributes to the premium cost. And I found that a lot of people, they didn't realize that the employer choice plans, as well as the employee choice plans, can be sold on a voluntary basis. I think a lot of times we just sort of talked about it, that the employer choice plans were contributory and the employee choice are voluntary. But now you can also offer the employer choice plans, those ABC plans, if you will, on a voluntary basis. And if you want a plan that the employee chooses which dental benefit plan they want, that would definitely be the employee choice plan with the 6 different options to choose from. And then the fully insured vision benefits, of course we've got that, and we'll talk about the separate vision insurance plan, but I wanted to contrast that with this vision discount program, again at no additional cost. Any Delta Dental member has automatically this vision discount program at no additional charge. So a nice range of different plans to choose from. Should have something there for just about any situation you run across. So with all these plans, it's gotten a little more complex than it used to be. I think dental used to be, do you want it? Yes. There you go. It's a little more complex than that these days. And so I wanted to put together just really some way to walk people through it and keep it as simple as possible. And so I've kind of boiled it down to just this 4-step process that'll really zero you in on the plan that is right for the particular group. And the first choice, I would say, is decide, okay, do they want the EHB or those ACA certified plans that we call plus plans, or do they not need that? The reason I have that as step 1 is because once you make that decision, you just cut the number of plans you need to choose from in half. So I think that's a good place to start. And then choose the network. Now, again, this really only applies on those employer choice plans where you get a choice of network. You can either buy just the Premier network, which we'll talk more about the networks here in a minute, or you can buy versions that include the PPO plus Premier network, the 2-tier network. And generally, those plans are a little less expensive because the PPO providers are contracted for a little bit lower fee schedule. And after you've made those 2 choices is the time you can just decide between plan A, B, or C. And then last but not least, do you want to plan with the child corrective ortho, yes or no? And so really, as I put down here, relative to years gone by, the only new step for us is really that first one in choosing, do I want an ACA compliant plan or not? So hopefully that helps simplify a little bit. So this is sort of a high-level just comparison of, and again, we're talking about the employer choice plans here. We've got plan A, B, and C. So this is kind of a high-level comparison of those 3 plans based on a couple important criteria. One of the biggest differences between plans A, B, and C is obviously the annual benefit max. They all include to-go, but you see that it varies. Plan B is, and has been, our most popular small group plan for the last couple of years, and it's the highest annual benefit max at $2,000. You see Plan C, which is really very similar to Plan B, but it's got a lower annual benefit max. And then Plan A is a little bit different than both of the other 2 in that it's got a $1,500 benefit max, but it's got a little bit higher co-insurance levels for even basic services, and so that one's a little bit different in that way. But then, so you see the difference in co-insurance, and both plans B and C. If you go to a PPO provider, Delta pays 100% of those. There's no member co-insurance for those. And then also on those 2 plans, the deductible is waived for diagnostic and preventive services. So under both plans B and C, the member is going to have absolutely zero pocket for the normal exams, cleanings, x-rays, things like that. So if that's the kind of plan they're looking for, definitely plan B or C is the one you want to look at. And then down on the bottom you see the dollar signs kind of equating to the least expensive to the most expensive. And again, Plan B is the most popular. Even though it's the most expensive, it's not tremendously more expensive for really quite a bit richer benefits. Okay, so here is just kind of going through. I'll spend a little time here. Most of the charts in our brochures and so forth are set up to look like this, so I wanted to just kind of walk through one of them, and then you'll kind of know how the rest of them show. But this is an example here of the employer choice, I should say Premier Plus Plan A. And you see it's got, at the top, it shows adult and child benefits separate because, again, this is a plus plan. So the child benefits are a little bit different than the adult. And so that's what you're going to see on any plus plan. You're going to see separate columns for adult and child. You won't see that on the prime plans. And then you see that Delta Dental Premier Dentist, those are the 2 columns on the left, and then out-of-network dentist benefits are on the right. You start at the top with your deductible, and as I mentioned, the deductible for an in-network dentist, the little asterisk indicates that it does not apply to diagnostic and preventive services. But then you get down here, again, this is Plan A, You see a little bit of difference in co-insurance levels. So the way these are shown, when it says 20% under adult, that means Delta's paying 80%, the member's paying 20%. And for the child, it's 25, we're paying 75. But you go on down there, you see the different co-insurance levels. And again, this is Plan A, so it's not as rich as a Plan B, for example. But then you see down at the bottom, again, this is how you know it's a plus plan, because it has this child annual out-of-pocket limit of $350 per child, $700 for all children in the household. Whenever you see that, you know you're looking at an ACA compliant, or as we call them, plus plan. And this particular example shows down at the very bottom the corrective ortho. And again, this is not the medically necessarily ortho. This is the corrective ortho, so braces and so forth. This has that option in it, 50% copay and a $1,500 lifetime benefit max. So that just kind of lays out how our examples show and how to interpret the co-insurance levels and so forth in those exhibits. So then here's what, again, the plan we just showed, the Premier Plus Plan A, an example of how we would rate for this particular plan. And we do charge a monthly per person rate. So again, the member can pick and choose who in their family they want to insure, and we'll just charge for that person. Now we do have size banded rates based on, unfortunately, enrolled. I wish it was eligible, because that you know up front. Enrolled, you don't necessarily know up front, and I know that can be somewhat problematic. But that's what these size bands are based on. So, for example, an employer that has 10 to 25 enrolled, their adult rate is going to be $23.28 per month. The child rate here is also going to be $23.28 per month, unless they wanted the corrective ortho benefit option. Then the child rate would be $31.84 a month.
So don't you recommend, Mike, just for the sake of quoting to a group, and you're not sure how many are going to enroll, for example, you just need to quote the $27.94, and then
some groups choose to do that. Others, you know, you kind of know going in that, well, we're going to definitely hit in this range. I mean, maybe they're on a plan today, they've got a certain number enrolled. You can kind of use that, but I'll leave that up to you. I've talked with agents, and there's varying philosophies on that. But you're definitely safe going with the base rate of over 1 to 5. And the other thing I would mention here is that anytime you're going to write one of these employer choice plans on a voluntary basis, and we'll talk about what voluntary is, but you would also use the base rate. So even if you've got a group that's 45 enrolled, if you're writing it on a voluntary basis, you're still going to use the base rate instead of the size banded rate. Okay. So what do we consider voluntary? Well, if there is no employer contribution or less than 50% participation, that's voluntary. So turn it around the other way. If the employer makes even $1 of contribution and participation is greater than 50%, you get to use the size banded rates. Okay. We do, just like our individual products, we do cap the rating at 3 child rates per family. So again, if you've got employers with big families, this is a good way to go. They get some free kids. And just in what I've looked at over the last 6 months or so, we are definitely more competitive in groups of 10 plus than we are in the really little groups, although we write a lot of really little groups too. But if it comes down to a competitive situation, you're looking at between a couple options. Once we get into that 10 to 25 or 26 to 50 rate band is where we really shine. All right. So that's the employer choice plan. So again, that's a situation where, traditional group plan, the employer picks one plan, and that's what's made available to the employees. Now we're going to shift gears and talk about the employee choice plan. And this is only sold on a voluntary basis, but I think it's a great solution. And because of some coverage we've added for 2015, I think it's a much more attractive option than it has ever been in the past, and we'll talk about what that is. But this is the plan where the employees choose, again, who they want to cover, because we use per person rates. So they can choose to cover, some of the people, just adults, just kids, whatever they want to do. They do get the choice now between EHB or a plus version of the plan or a non-EHB version. And this is on an individual employee basis. So, one family can choose, yes, I want the EHB benefits, another can choose not. It all works fine within the same plan. And then within those two types of coverage, we've got the 3 levels of benefit that they can choose from. Just like we've done on the individual now, there's preventive, preferred, and platinum are the 3 levels. And I guess I mentioned that already. Groups, employees can mix and match whatever level of plan, if they want plus or prime or whatever. All that can be mixed and matched, all within the same group. Now, on these plans, the network choice is already made for you. It's the PPO plus Premier Network. And the reason we do that, again, is because we have so many PPO providers in the state now. And so we just kind of factor in, how many of those providers and what's the likelihood of somebody going to a PPO provider. We factor that into the pricing, and so the pricing is kept down for the whole group somewhat by using this dual tier network. And so this is similar to what we saw earlier on the employer choice. This is the plan comparison for the employee choice plan. And again, the employer is not really choosing which one of these to put in. If the employer chooses to put this employee choice plan in, all 6 plans are available to the employees. So there's really no choice to be made by the employer. But you can see, again, we've added 2 new tiers now. We used to have preventive, comprehensive, and catastrophic. We've done away with comprehensive and catastrophic. And in their place, we put platinum and preferred. And you see, again, the differences along the top on the annual benefit max. The platinum is the most rich plan, $2,000, preferred's at $1,000, and preventive doesn't have a limit, but that's because the services provided under that plan really never make it up to a very high level in a particular year. Got some deductible differences. Again, the platinum plan is the lowest deductible, so it's the richest plan. Then you see the different coinsurance levels there. On the platinum plan, you see some differences because there's a little bit of difference between a PPO provider and a Premier provider. So how to interpret that particular slide there: diagnostic and preventive services. If they go to a PPO provider under the platinum, it's no out-of-pocket for them. We pay it all. If they go to a Premier provider, we're paying 90%, the member's paying 10%. So that's how to interpret that. And then, as you would guess, down at the bottom, the more expensive plan is platinum, then preferred, and then finally the most cost-effective plan, or the least expensive, is preventive. Not really talking about it necessarily, how we handled renewals. Probably aware of it by now if you had anybody on this plan. But by removing the comprehensive and catastrophic tiers that we had before, we needed to move some of those folks over to the new plan. So anybody that was on the comprehensive tier in the past, when we renewed or when we will renew their plan, they will move to preferred. folks that were on the catastrophic, which weren't very many, convert over to the platinum plan. And that's important for you to realize, because when you get that renewal, you're going to have a little bit of sticker shock, because the platinum plan benefits are much, much richer than the catastrophic were in the past, and you're going to see it's much more expensive. So, people are first going to open it up, look at the what happened to the rate, and see quite a jump, but that's because the benefits under the new plan are much different than what they had before. Now, I mentioned that the preferred and the platinum plans are much more attractive, I think, to employees than what we had previously. The main reason for that is that we have now included benefits for extractions and oral surgery under both the preferred and the platinum levels. Benefits for extractions and oral surgery were not available under any of our voluntary plans in the past. So that's a huge addition for this year. Okay, so that's kind of the dental plan part of it. We'll talk for a couple minutes here on about Delta Vision for small groups.
Mike, before you go ahead,
Yeah.
Can you go back to that slide?
Sure.
Just go back one.
Mm-hmm.
Where is the oral surgery in terms of what does it pay?
It's going to fall into the routine and restorative.
Okay.
Yep.
So depending on the provider, it's either 20 or 30% that the member would pay.
That the member would pay, correct.
Okay, good. I just didn't see it listed there.
Yeah, that's a good catch.
Okay, thanks.
You bet. Okay, so just to reiterate on Vision, we have the Vision discount plan that everybody gets. They don't sign up for it. They don't enroll in it. They just have it by virtue of being enrolled in a Delta Dental dental plan. This is available or gives discounts to at only network providers, which we use the iMed, it's called the Access Network. iMed has several different networks, kind of like we do. Their Access Network is their broadest network, so the most providers, and that's what you've got access to with the discount plan. Also under the discount plan, there's no frequency limitation on anything. So every time you go in, you're going to get your stated discount. There are different discounts for things like lenses and exams and frames, things like that. If you've got something that's not specifically on the schedule, it's just an automatic 20% discount right off the top at any network provider. So it's a really, it's a pretty good plan. Stacks up with any of the discount plans that are out there, and again, it's free just by being a Delta Dental member. Then we do have certainly insured vision plans. Again, we've got kind of like the dental, both contributory and voluntary plans. Contributory plans require 50% contribution and 50% participation. So a little higher threshold than what we had on the dental plans. The voluntary obviously doesn't require any kind of employer contribution, but it does still require at least 20% participation of eligible employees to enroll, with a minimum of 2 enrolled. So for whatever reason, we can't have a group of 1 on vision like we can now on dental. One of the nice things about having both the dental and vision with us is we can do combined billing of both, so that's a positive. The vision contract is a 2-year contract, and so we guarantee the rates for the life of the contract. So they're, in essence, a 2-year rate guarantee. Now, I will mention that we are taking a slight increase effective July 1st of 2%. So that's the first increase since July 1st of 2013, when we also took 2%. So it's just creeping up a little bit. Everyone should be aware of that. So if you're writing anybody 7-1 and after, or you've got renewals coming up that are 7-1 and after, they'll see a slight rate increase. And I mentioned the network we use, the iMed Access Network. They've also got their own mobile app if anybody's into that. We'll talk about our dental mobile app in a little bit, but iMed's got one of their own that's pretty slick to use. You can pull up providers, your claims history, all kinds of different things. So here are the vision plans that are available kind of across the page, starting on the left with the richest benefits and moving over to what we call our materials only plan on the right, which obviously by the name doesn't include any exams or anything like that. It's just contacts, frames, lenses, things like that. But you can see the basic difference here between all of the plans, and these are the same whether it's voluntary or contributory. The plans don't differ. The only thing that's different is the rates you would charge. But you start on the leftmost column, and it's the enhanced plan, the richest plan, $150 annual allowance for frames, and then the $10 copay, and then they get to choose the copay that they would have on lenses. So every one of these 4 plans that you see here has a $10 lens copay option or a $25 copay option. And depending on what plan they choose, the rates are obviously a little bit different. But you can see how, again, really it's the frame allowance that is the, or the contact lens allowance, whichever one you want to look at, which differs between these plans. Enhanced is $150, preferred is $130, standard is $100, and then the materials only is $130 as well. And so again, different levels of discounts. There are LASIK benefits. You do have to pre-arrange that. There's a 800 number you call iMed and talk to them about the LASIK, but there are benefits for that as well as just the regular exams and glasses and contacts, things like that. One other thing that people ask about a lot, needs clarifying, the frame and contact lens allowance is you don't get both of them in the same year. So you get $150 on, maybe contacts this year. You can use that $150 allowance next year for frames. You don't get them both in the same year. So it's one of those 2 every 12 months. How that works. I wanted to show this just because a lot of times I hear that people just throw this away. So this is what they would get. This is their vision ID card. So this again is not the discount plan. This is an actual fully insured plan. And it's actually a nice mailing package they get from iMed. And I think that's probably why it gets misplaced a lot, is it doesn't come from Delta Dental. It comes from iMed, and that's what it says on the outside envelope is iMed. But it does have their Delta Vision ID card, and then obviously you can't read it, but over on the right-hand side, it shows their 10 closest providers, their schedule of benefits, things like that. So they get all that on one nice little piece, and they can just punch the ID card out. So I guess the main thing here I want to emphasize is if you've got somebody that signs up for Vision, please let them know that they will be getting their ID card in a separate mailing from iMed and not just to throw it out, because that's what it is.
So Mike, can somebody buy the Vision without buying the dental?
They can.
Okay.
Yep, you can buy just the Vision. We've got a lot of groups that have done that. Yep. Okay, so I just briefly want to walk through some things that are on the website, or that it's important for people to know when you're working with employer groups. Finding network providers, and again, our dental plans, for the most part, use the PPO Plus Premier. And so the easiest way to find a local provider is just go out to our website, which is deltadentalia.com. Don't forget the IA. And this is where you'll land. And then so just click on provider search, and then you can either do a dental or a vision provider search. Just click on the one that you want there. And then what you'll get is just a screen like this. You can type in just the city and state, or just a zip code. Or if you weren't looking for a particular dentist to see if they're in the network, you can just type in that dentist's name and then hit search. And what it's going to return to you, well, this is just a little bit more. You can pick the radius you want to look at, anywhere from 5 miles up to 50 miles. You can pick a specialty if you're interested in that. And then I talked a little bit about the two-tier network. So down where it says narrow search, you can either, if you're only wanting to look for PPO providers, you can click on that. And then different features, they say, well, I've got evening hours, or I'm wheelchair accessible, or whatever the case may be. You can kind of skinny down your criteria there, and then your list that you get is just going to have those providers that meet that criteria. So it's a nice tool to find providers, whether it be dental or vision providers. And just some of the other member resources we have, because obviously you're always wanting to encourage enrollment, with an employer, things like that. We've got a lot of member resources available, and one of the big things is our online access for members. A lot of times I'm sure you get those requests too, where so-and-so lost their ID card and we need to print a new ID card or whatever. Well, members can do a lot of self-service if they go out to the website and sign up for what we call Member Connection. They just go online, register. They will need the information off of their ID card. And then once they register for that, though, they'll have access online to claim status, eligibility information. The big one there for me is printable ID cards. They can print that right there whenever they want it. They get their EOBs. They can look at frequency and age limitations, all kinds of different things. So it's a really handy site and can actually be helpful for the employer, so they don't have to take the requests all the time. Can I get a new ID card sent out or whatever? So again, the way you do that is just go to our website, click on Member, and then Enroll Now, and they're going to type in their member number, and they're pretty much set to go. That's basically what I had. At this time, we don't really have any sort of online applications, things like that. Again, all of the groups that fit in this particular space, the 1 to 50 size, are all what we call book rated. So, we showed the rates, the per person rates. There's really no customizing of the plans or anything at this level. That starts at 51 plus eligible. But just, if you've got any questions about rates or need materials, obviously the folks here at KHI can help you out with all of that. But all the rates are going to be set, and they are guaranteed through 2015. So they're 12-month rate guaranteed.
Great. Well, thanks, Mike. Let's go ahead and take some questions now. And I see we've got one already from Dean. If a defined contribution plan is used and the employee uses those funds towards a health policy, is the plan an employer choice or an employee choice plan?
Yeah. Great question. So basically, I'm going to change it a little bit because I guess what usually I get asked is it considered voluntary, or will we consider contributory? And the answer is that we are considering those contributory. So if it's a defined contribution plan and the employer makes any kind of a contribution to that employee's bucket, if you will, even if none of it's going to go to dental, we're still going to include that or consider that contributory because the employer is making a contribution. Because there's really no way, that's going to vary from individual to individual as to will they spend any of their dollars on dental or not. We don't know that. But we have made the decision that any time there's an employer contribution to a defined contribution plan, we're going to consider it a contributory plan.
So therefore, it would be the employer choice plan, with the employer needs to choose
Yes.
the plan offering and
Yep.
and then offer that to the
Right,
folks.
and the advantage there again is, of course, you get to use the size banded rates versus the voluntary only rates. So yeah, it can make a big difference. So that's a great question.
Great question, Dean. Okay, any other questions, even from here in the room?
Is there a way for an employer or an agent to print off temporary cards for a member if they're misplaced?
We can
Can you
give,
repeat the question, Mike, just to make sure
Yep.
everybody heard?
yeah, the question was, is there a way for an employer or even an agent to print off a temporary card? And employers can, through the Employer Connection site, that they should automatically get signed up for. Now, I know a lot of people, lose their information. We can help them with that. But I would encourage employers to use that site. It's kind of like that member connection site I talked about, but at the employer level. So they can pull up invoices, they can pull up eligibility, they can manage their eligibility, add and drop people, and they can order new ID cards for people. So that's a big deal. Now, we can actually give the agent access to the group's account through Employer Connection as well, if that's something that the agent would want. So just let us know who the group is, and we can go ahead and get you set up as an administrator, and then you'll have access to do that. I'll leave it up to the individual agent to decide if they want to get into that world or not. Some do, some don't.
Great. Another question that Brenda has is, can you provide a little more information on the unused benefit carryover, and can that continue to carry over year after year?
Yeah, that's right. I didn't really go into that. So that to-go feature, as we call it, that's automatic on the employer choice plans that roll over. Let's take the example of they bought Plan B, so that means they've got a $2,000 annual benefit max, and let's say the individual only uses $1,000 of that. Well, what happens then is the next year they get the unused $1,000 in their to-go bank, as we call it, and so their total annual benefit max that they've got available that following year is $3,000. Now, they can build, it caps out at 2 times whatever the underlying plan that they're on is. So let's take Plan A, for example, that has a $1,500. Members can build to a maximum of $3,000 between their to-go bank. So it always caps out at 2 times. And as long as they have at least one service performed each year, because we obviously want to encourage that preventive type treatment, as long as they have one service per year, they will continue to roll over year after year. Again, up until they reach the max, and then it'll just stay there. So again, Plan B, it's our most popular plan. We've got a lot of folks out there with $4,000 of annual benefit max to use. And I think that's something that a lot of times employers forget about. Hey, I'll say it, it's a retention tool for us. Their employees have built up these large to-go banks, and if they decide to leave us, they lose all of that, obviously. So it's an important thing to consider, especially when you've got employees that might be needing some major services in future years. They want to build up those to-go banks, and it's a big benefit. So that's the way that works.
You had mentioned the mobile app, just Delta Dental. You search it at like the Google Play Store, the iStore, or whatever.
Yeah, I think it's actually right now it's just for the iPhone, if I remember right. So it would have to be on the Apple Store. Yeah.
Well, I did just go to Google Play, and I did see it. So.
Oh, good.
And so, but what I was wondering, it says Delta Dental Plans Association on my Android. So
yep,
that be the one?
That's it, because it is done nationally. Yeah.
Okay, great.
And it's a really nice app. We're going to be adding a lot more features to it than what it's got now. But you can pull up, eligibility, EOBs, your ID card. Again, that's a great place. You just walk in with your ID card right there on your phone instead of having to keep track of it. But we're going to be adding a lot more information to that, reminders about, maybe when your next checkup is, things like that. So we're going to connect through to some of the providers and make a lot more information available on that.
Okay. It does have a toothbrush timer on it.
It does.
Looks like, yeah. So
yeah.
Remind those kids to brush their teeth.
That's right.
Like that,
It plays a little tune, and for 2 minutes, and then it rings and says you're done. But.
Okay, great. Well, I'm not seeing any more questions. I think we've answered them, and I guess we've got a little bit of time left. But unless there's any more questions here in the room, Or Mike, any other closing comments or thoughts?
You know, I guess the one thing I've seen here in the last few months since these products have come out is there is a lot more interest now in that employee choice voluntary plan because of the fact that we've added extractions and oral surgery benefits. You know, that was kind of a non-starter for a lot of people before because it's a fairly basic service. It just was never there. So now that that's there in the preferred and the platinum tiers, it's really, I'm seeing a lot of interest in that particular plan. So, you know, that's one thing. And then just that fact that even those employer choice plans, they can also be sold on a voluntary basis. Those are probably the two big keys.
Great. Well, as always, if you have any other follow-up questions, the folks on our group agent service team, if you will, Sarah, Tricia, Nakia are here to help you guys. So if you have any questions, let us know. We'll get that, get you on board if you need any other quotes or any other support for products. So let me just say thanks to everybody, especially thanks, Mike, for coming up to Fort Dodge today and working with us. And thank you guys for joining us on the call. And we wish you a great day, and we'll be in touch and talk to you real soon. Thanks. Bye-bye.